If you have patients with an autoimmune condition, it's not surprising. According to the National Institute for Environmental Health Sciences, autoimmune diseases affect over 23 million Americans. Autoimmune diseases can be difficult to treat because causal factors are hard to pin down, and discerning which aspect of the immune system is overreacting can be challenging. Welcome to What the Science Says when it comes to autoimmune issues. So first, let's review the immune system. Everyone has, in a sense, two immune systems: the innate immune system and the adaptive or specialized immune system. The innate immune system is everything an individual is born with to protect them, like the skin, saliva, mucous membranes, and stomach acid. They prevent viruses or bacteria from getting a foothold in the body. Within this innate immune system are phagocytes and neutrophils and natural killer cells that attack dangerous threats and render them harmless. So the adaptive or acquired immune system defends the body based on experience. It includes B cells, T cells, antibodies, and white blood cells that recognize invaders that have survived the innate immune system and either bolster the body's own immune response or destroy infected cells so they are removed from the body altogether. Okay, so with all this going on, what triggers an autoimmune disease? The potential triggers for autoimmune diseases are plentiful. And one of the reasons that autoimmune diseases could easily increase is because people develop a high number of autoantibodies, T cell actions against the body's own structures after exposure to environmental toxins. Autoantibodies, most commonly anti-nuclear antibodies or ANAs, can have many causes: age, family or genetic predisposition, and the interplay between hormones and overall health. In fact, women are more likely to develop autoimmune diseases than men. The National Institute of Environmental Health Sciences reported that autoantibodies can develop for years before they begin actually attacking tissues. They re-examined the data collected during the National Health and Nutrition Survey from 1999 to 2004 with an eye toward uncovering more about the mechanisms and the correlations of autoimmune diseases. They reported that some potential triggers and correlations included the following: solvent exposure, so including proximity to paint thinners, cleaning supplies, and nail polish, contributes to the development of systemic sclerosis. Also, smoking, which contributes to the development of two types of rheumatoid arthritis. Having children, believe it or not, especially more than one, contributes to ANA prevalence. Workers exposed to fine particles of crystalline silica found in quartz, granite, and many other minerals are prone to developing several autoimmune diseases. And anyone in mining, construction, or other building work is definitely at risk. Gluten consumption contributes to the development of celiac disease. This, of course, is something that practitioners have been aware of for some time now. Reactions to drugs or bacterial and viral infections also put people at risk. The Epstein-Barr virus is frequently identified as a triggering mechanism that begins immune system hypervigilance. But anything that creates an extreme response on the part of the immune system may make it difficult to pull back into balance. And whatever the cause, the very tissues and systems that form part of the innate immune system, including the skin and digestive tract, become a victim of attack by the adaptive immune system. You've probably treated patients dealing with pain, swelling and stiffness in their joints, skin rashes, inflammatory bowel diseases, or thyroid disruptions, all results of immune system overvigilance. Another challenge to practitioners is that the signs and symptoms of autoimmune diseases can be so varied and so interconnected with coexisting conditions that it can be difficult to narrow down an effective treatment plan. In my experience, patients with underlying immunomodulation disorders have suffered through multiple symptoms. This seems like a daunting list of symptoms, and it is. Many of them can appear in the same patient in what seems like completely unrelated problems. Someone suffering from joint pain, for example, may be also dealing with brain fog or rapid heartbeat, or extreme sensitivities to light, temperature, and foods. It's an incredibly complex puzzle. And for this very reason, that autoimmune conditions share so many similar traits, it is common to see the same conventional medications used for different diagnoses. But unfortunately, many of these conventional medications come with a load of side effects and aren't ultimately a long-term solution. As practitioners, we have workable options taking into consideration the whole body treatment to help balance their immune response. First, healthy sleep may not solve everything, but it definitely comes close. I recommend that patients stop screen time within an hour of going to bed, so no TV, smartphones, or laptops. Watch caffeine intake during the day. Effects of caffeine can linger up to 8 hours, and get into the habit of creating a ritual to anchor bedtime and rest, making getting ready to sleep a daily habit rather than just something to lapse into or do between busy days of intense, stressful effort. Which brings me to point number 2, which is stress. Patients with autoimmune concerns, or any concerns really, need to be actively reducing stress. That can mean encouraging them to reconsider what their minds focus on during the day. Do they ruminate over potential problems, dwell on the past? Is there an ongoing monologue of negative self-talk happening? To help them work past this and develop more resilience, they may consider yoga, qigong, and/or things like meditation. Yoga, actually, at a variety of skill levels and physical intensity, has become pretty close to ubiquitous. Qigong could be described as moving meditation and combines slow body movements and mindful breathing as well. For those with autoimmune conditions and issues with immune system imbalances, Qigong could actually be especially helpful. There was one study that showed a statistically significant positive effect on immune cells and immune response after just 1 month of daily Qigong training. Other research of meditation has investigated its role in reducing inflammatory states. Work at the University of Wisconsin found that experienced meditators versus healthy, age-matched non-meditators showed lower neurological inflammation response. Long-term meditation has also been found to boost a sense of well-being. Environmental toxins can be a big problem as they can disrupt the immune system. Avoid all possible exposure to environmental toxins such as mercury, poisons, and heavy metals. This may simply take the form of eating organic foods whenever possible, but it may also mean that patients will need to be vigilant about their home spaces and what kind of chemicals and toxins they allow in it. There is absolutely a connection between diet and mind and body health. Inflammatory foods make everything worse, but inflammatory foods are sadly prevalent in the American diet. If your patients overindulge in refined grains and sugars, vegetable oils high in omega-6s, cured meats, or deep-fried foods, it's going to throw their immune system into red alert. Just the addition of anthocyanins from increased fruits and vegetable intake alone may make a difference. There was a cross-section of the Framingham Heart Study found that anthocyanins reduced 12 different inflammatory biomarkers in populations of American adults. The researchers reported that individuals with the highest consumption levels of these healthy compounds had a 73% lower overall inflammation score versus those in the lowest consumption groups. Of course, interventions with clinically studied nutrients is definitely part of a practical treatment plan. Matched with anti-inflammatory diet and other lifestyle measures, there are effective clinically studied supplements. Curcumin from turmeric has been shown to reduce pain and inflammation in patients with rheumatoid arthritis and may be helpful in treating patients with multiple sclerosis as well. Since pain relief is certainly a major factor in rheumatoid arthritis treatment, curcumin is often recommended because it offers relief and reduces inflammation without negatively affecting immune function or other body systems. Conventional drugs that treat rheumatoid arthritis are often only a short-term solution because they can cause cardiovascular, renal, and liver damage. Vitamin D. Vitamin D helps regulate the innate immune system and reinforces epithelial cells' function as a barrier and defense. Vitamin D supplementation may reduce symptoms of autoimmune diseases and endocrine disorders, and multiple sclerosis, IBD, and other autoimmune diseases may all be affected by low vitamin D levels, possibly from birth. Clinical research of patients with chronic autoimmune atrophic gastritis showed reduction in vitamin D levels due to a possible impairment in absorption. So if your patients with autoimmune conditions have vitamin D receptor issues, it may mean that you need to make sure they are compliant with clinical strength dosages. Essential fatty acids. These can help build healthy, robust cells and tissue structures and have anti-inflammatory strength of their own. If you're moving your patients with rheumatoid arthritis off of conventional painkillers, there's a good reason to make essential fatty acids part of that protocol. Probiotics, they continue to show their value for a variety of conditions. In the case of individuals with autoimmune diseases, recommending probiotics may help them reset their intestinal microbiome. The Western diet has a lot to answer for here, and research of individuals around the world show that when people adapt a Western diet, low in fiber, who haven't traditionally consumed one before, it can change their microbiome dramatically. This could ultimately cause autoimmune problems later in life. One of the many beneficial bacteria, Lactobacillus rhamnosus, was mentioned in a review conducted by Spanish researchers to reduce symptoms of inflammatory bowel disease, and mentioned that it appears to strengthen the intestinal barrier, potentially preventing leaky gut syndrome. Other clinical work has shown that Lactobacillus rhamnosus and a variety of bifidobacterium species may reduce symptoms of IBD conditions as well, but need to be recommended strategically in the acute phases of the condition. Autoimmune conditions are notoriously difficult to treat and such a struggle for patients who have them. But with a holistic approach that incorporates mindful and body-wise interventions, your patients may finally feel free of symptoms and more vibrant than they have for years. So if you've had experience treating patients with autoimmune conditions, by all means like this video and comment below so we can keep the conversation going.